Margaret, you work with some people that had very serious trauma in their life, terrible sexual abuse and being involved in wars and violence and terrible things, and you've worked with lots of them over the years. What percentage of these people do you feel the inner bonding, the inner work is not enough and you feel that they really need pharmaceutical drugs or antidepressants?
Frankly, I don't think any of them ever do need pharmaceutical drugs. I never recommend that, ever. I just refer them to Irving's book. People who have been through a lot of trauma, they need a lot of help. And inner bonding is one of the forms of help. It's not the only form of help. I also recommend that they get trauma therapy. There's many forms of trauma therapy now that are very, very helpful to people. The emotional freedom technique, the revolutionary trauma release exercises, somatic experiencing, EMDR, there's more, there's many of them that help to release trauma out of the body. And these work very, very well in combination with inner bonding. One of the things that happens as people practice inner bonding, it's about developing what we call a loving adult self. And when you learn to be a loving adult, and when you're focused on what is truly loving to yourself, then you're going to be very motivated to take loving action, which means you're going to get adequate exercise, you're going to get adequate sleep, you're going to take care of your finances, you're going to eat well, you're going to take care of yourself in relationship to other people, you're going to get your life organized, and you're going to develop your spiritual connection. A loving adult attends to all of those forms of personal responsibility. And when you actually do that, you get better, regardless of the trauma that you've been in. I mean, what Stephen said is accurate. I've worked with people with the most severe trauma that you can ever imagine, and they heal without medication.
Irving, if you are confident after you wrote the book, it's been years since then, and you've had more studies that support this, and if your studies showed that the chemical ingredients in the drug were not responsible for the improvement from depression, has your research become widely accepted and the standard throughout the country?
My research is very controversial. Internationally, it's had an impact. It's having an impact. It had an impact in the United Kingdom, where they changed, not just on the basis of my research, but on the basis of other people's research, finding the same kinds of things that we have found, and they changed their treatment guidelines for depression. One of the things they decided is that more emphasis should be put on psychotherapy. And one of the things they've done to make that possible is undertake a program. The British government, this is something that united the Tories and the Labour Party. They don't get united very much. They all approved this together. They undertook a program to train 10,000 new psychotherapists to provide free psychotherapy to depressed people through the National Health Service in the United Kingdom. They did that because of evidence that it cut the rate of relapse compared to putting people on antidepressants, and that in the long run, it's actually cheaper. It's actually cheaper because psychotherapy comes to an end and you don't need it anymore. And you go about your life and you're not incurring treatment expenses. Whereas with the medications, you wind up having to stay on them to avoid relapse. And actually the data, there was a cost-benefit analysis done in the United States. There was a cost-benefit analysis done in the United Kingdom, and they came to the same conclusion. While the initial cost of psychotherapy is greater than just giving somebody a pill, at 9 months, you break even. And from that point on, it's cheaper to have been on the psychotherapy than to be maintained on antidepressant medication, and safer, and in the long term, more effective. Short term, no real difference. Long term, more effective.
You know, I'd like to share something that, you know, you mentioned the SelfQuest program that I worked on for so many years, and a woman wrote to me who had bought the program who I'd never met, and she said to me, after doing SelfQuest, I got off my antidepressant medication, I lost 110 pounds, and I went back to school and got my degree, and my whole family, my kids, my relationship, everything is improving. That's where my heart is, that people can actually do it on their own. They can learn this on their own, that they don't have to spend tons of money. Another woman wrote to me, and she said, and I had also never met her, and she said, I've been on heroin for, this isn't depression, but probably she was depressed, and she used heroin instead, medication, and she said, and I've been to every treatment center in the country, and I haven't been able to get off until I went through SelfQuest. She says, now I finally see why I was on heroin, why I was so miserable, and what I need to do, and I've been clean for the last year when she wrote me. And she's kept in correspondence with me. Her whole life changed. So it's possible for people to learn to do this without being tied into medication their whole lives. It's possible for people to learn how to heal themselves. And that is what I teach people to do, how to heal yourself and to be free of that and to be dealing with yourself in a way that brings inner peace and joy rather than depression and misery.
Can I follow up on my answer to your question, Steve? You know, change in medicine is often very slow. It takes time. There was a surgical procedure they used to do for angina back in the 1950s called mammary ligation. Seemed to work. 80% of people got better. They did 2 trials with sham surgery as a control. You know what sham surgery is? Placebo surgery. They open the patient up and they sew the patient back together again and they don't do the mammary ligation. And it had the same success rate. They don't do it anymore. There's a surgical procedure called arthroscopic surgery for osteoarthritis of the knee. That was studied with a sham control as well. And when they cut the patient open, they didn't do the surgical procedure, but then they sewed the knee back up again. For the first year, the people in the placebo surgery group actually did better than the people in the real surgery group. And at 2 years, there was no difference between the two. But you know, they still haven't stopped doing it.
Well, it's a moneymaker.
It's not just that it's a moneymaker, it's you have to have an alternative. There is an alternative here, and it used to be, when I started practicing, psychiatrists, like psychologists, used to do psychotherapy. And some of them still do, and some still do. But most psychiatrists have gotten out of the psychotherapy business. So what do they have? They have the pills, and there's an old saying, if what you have is a hammer, everything looks like a nail.
Yeah, and I think what you said is so important. They don't know what the alternatives are. They don't know what to offer. And I see this over and over again with medical doctors who are not tuned in to what's really going on. They don't know what to do.
But it will change.
Yeah.
It will change. My prediction is 50 years from now, people are going to look back at the antidepressant era and look at antidepressant medication the way we now look at bloodletting.